Hello, I'm Dr. Carrie Cardinal of Cardinal Chiropractic, and welcome to Regaining Your Youth and Vitality. These are the keys to staying young for a lifetime. In general, there is a correlation in body structure, health, and span of survival. So we have a choice on how we age. We are either going to wait for illness to happen, or we can begin living well today. So if I was to tell you that I had some tips on how to age gracefully with youthfulness and vitality, would you be interested in hearing that? Well, I hope so, because that's what we're going to be talking about. World Health Organization, in a study of 191 healthcare systems of all of the major industrialized countries in the world, the US actually ranks number one in crisis care. So that means we're the best place to be if you're in a crisis. So if you have a heart attack, if you have a stroke, you are in the best place to be to receive care for that. However, we are only 37 when it comes to healthcare. So yes, we might be the best place to be if we're in a crisis, but when it comes to our health in general, we're probably not in the best place to be. In fact, the US has the most expensive healthcare system in the world. In 2005, the US spent $2 trillion on healthcare, yet we ranked only 34 in life expectancy, and we only ranked 26 in infant mortality. And we also have 20 to 30% of patients who receive contraindicated care. So that means care that you don't even need. And in fact, it's probably worse than this because many of these cases are actually not even reported. Perhaps the word healthcare has given us the illusion that medicine is about health. In my opinion, we have what's called sick care and we have health care. So, sick care is the care that keeps you sick. So, this might be the medication that you're taking every day, but things aren't getting better. Health care is where you're actually getting healthier and you're seeing results. Out of 13 countries in a recent comparison, the United States ranked an average of 12, second from the bottom for 16 available health indicators. And the poor performance of the US was recently confirmed by the World Health Organization, which used different data. However, it ranked the United States as 15 among 25 industrialized countries. And this is actually taken straight out of the Medicare handbook. Care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary. Now, that gives me pause because that doesn't make sense to me. To me, that's the very definition of medically necessary. Why wouldn't you want to promote health or prolong and enhance the quality of life? That to me is healthcare. However, today in this country, people die of three major diseases. Can you name them? Do you want to guess what the number one cause of death is in the United States? Well, if you guessed heart disease, you are right. There's 647 deaths from heart disease. That is one out of every four deaths. And this year, an estimated 805,000 Americans will have a new or recurrent coronary attack. The number two cause of death in the United States is actually cancer. It is over 559,000 people that die every year from cancer. It's 21% of all deaths. In fact, 1.8 million new cancer cases and 606,000 deaths are expected in the US in the year of 2020. And this is actually expected to get worse. Now, do you want to guess what the third leading cause of death in the United States is? You probably didn't guess this, but it is medical care. Yes, 250,000 people die every year from medical care. 20 to 30% again receive that inappropriate or contraindicated care. 106,000 die from the negative effects of drugs. 80,000 people die from infections contracted in hospitals. 12,000 die due to unnecessary surgeries. 7,000 die from medicine errors. And 20,000 die due to other medical errors. This is kind of scary. I'm not telling you to not get medical care when you need it. Of course, get medical care when you need it. Remember, we're number one when it comes to crisis care. What I am telling you is when it comes to your health care, you have to be your own advocate. You have to be the one that makes the healthy choices and the healthy decisions to keep yourself healthy. Because the very system that we have created isn't the best for us when it comes to health care. Remember, we're only 37. So what is the life source and health of your body? Believe it or not, it is energy. The life energy in your body is electricity. Of the 9 systems of the body, the nervous system, which is your electrical system, is supreme. It regulates and controls all other systems. So your brain is the master controller of your body. It controls everything that you do. So your brain sends that energy, which it basically is nerve impulses, down your spinal cord, and your spinal cord carries those nerve impulses through the nerves, and then those nerves go to every single cell, every single tissue, and every single organ of your body. So your brain controls every function of everything that you do. So yes, your heart beating, your lungs breathing, and even your digestive system. Now, this is showing your digestive system on fire. And this is just to show you that sometimes when we have organ dysfunction, it can be caused by issues that are going on in the nervous system, which is being affected by what's going on with the posture and the spinal alignment. And that's what we're going to dive into in just a moment. But 1 cubic inch, of the brain's cortex contains 10,000 miles of nervous tissue. That's a lot. And that nerve energy travels at the rate of 270 miles per hour. And out of the 9 systems in the body, only 1 is encased in bone. And why is that? That's because your brain and your spinal cord are so delicate and so important that they have to be protected by bone. So your spine is the core strength and health of your body. That means that if you lose the health of your spine, you are losing the core strength and health of your body. Now, when we look at your posture, what we would like to see is that your head is balanced over your shoulders are balanced over your pelvis, and then your pelvis is balanced over the mid-stance between your feet. And then inside, your spine should be completely straight up and down. Now, from the side view, when we look at your posture, your ears should be balanced over your shoulder over your hips, and then your hips over your ankle. And then inside, you should actually have 3 curves to your spine from the side view. So we should see a forward curve in the neck. It goes backwards in the mid-back, and then again forwards in the lower back. So it kind of looks like an S shape. And these curves, believe it or not, are essential for the health of your spine. And we're going to also be talking about that in just a few minutes. If you regard posture as the result of the dynamic interaction of 2 factors, the environmental force of gravity on the one hand, and the strength of the individual on the other hand, so that's basically your posture, then your posture is but the formal expression of the balance of power existing at any time between the 2 groups. Thus, any deterioration of posture indicates that the individual is losing ground in the contest with the environmental forces of gravity. So this is saying that your spine has to be stronger than the forces of gravity, because if it's not, then gravity will win. And this is when we start to see accelerated aging of the spinal joints and the spinal discs, which can cause joint decay and disc decay. Now, of course, as we age, we tend to deteriorate over time. This is a normal process, but we have a normal aging process and we have an accelerated aging process. We know through the research that when we have poor posture, when we have poor spinal alignment, that this accelerates the aging process of our spine. So again, this can cause spinal decay, joint decay, and disc decay. So a subluxation is a term that means that your spine is out of alignment. Any abnormal posture would be an example of a subluxation. So trauma or stress to the body can cause the vertebra or the spinal curves to shift out of place from their optimal form and function. And this again would put abnormal stress and strain on the muscles, abnormal stresses and strain on the joints, abnormal stresses and strain on the discs, and also abnormal stresses and strain on the nerves. And wherever that nerve is going to, you can definitely maybe start to see some signs of dysfunction. So this is what the neck curve looks like from the side view. This is a normal alignment. So this person will be looking in this direction. So this is where their face would be, and this is where the back of the head should be. So we should see a nice normal curve in the neck, okay? This is an example of an abnormal neck curve. And unfortunately, this is often what we see in this office. So instead of having that nice healthy curve like the black line, What we see is what the red line is doing, where that curve is actually going in the opposite or reverse direction. Subluxations of the individual vertebra or the whole curves, especially those caused by soft tissue injury, which would be like a car crash, can accelerate degeneration. Again, early onset of spinal decay and joint decay. And this can lead to disability and are also known causes of morbidity. Now, this is a wonderful picture because this shows you what's going on the inside. So we know that abnormal stresses and strain is also occurring on the joints and on the discs, as we just saw, but it's also occurring on the spinal cord and the spinal nerves. So this is showing you the spinal cord and the spinal nerves in a healthy neck curve, and this is showing you the spinal cord and the spinal nerves in an unhealthy neck curve. So here, the spinal cord is nice and relaxed. We can see the nerve root that comes right off the spinal cord is also nice and relaxed. And the space between the bone and the nerve root is actually open. So this nerve is able to function properly. And all this kind of dark gray squiggly stuff that you see, those are the blood vessels. So these blood vessels are nice and open. The spinal cord is getting lots of nutrients. And so that spinal cord tissue is staying nice and healthy. When we have an abnormal neck curve, the spinal cord and the spinal nerves actually get pulled taut, almost similar to how you would stretch out a rubber band. And when those nerves get pulled taut, it actually stretches them out and it can slow them down. So remember, they should fire at 270 miles per hour, but with this type of stretching that can happen, it can cause that to slow down. So if we look at the nerve root here, it's definitely pulled taut, again, comparing it to this nice relaxed one on the opposite side. And then again, that space between the nerve root and the bone is much more diminished. And so there could be some direct pressure on that nerve as well. And then that black squiggly stuff, those blood vessels aren't as open. So the spinal cord tissue is not getting all of the nutrients that it needs. So again, when we have misalignments in our spine, it can affect the joints from decaying and the discs from decaying, but can also affect the spinal cord from sending those nerves as fast as they should, and also those blood vessels from being as open as they should, giving that spinal cord that nutrient that it needs for those tissues to stay healthy. Head and neck posture is a major factor in the fatigue and immune functions in patients suffering from fibromyalgia, chronic fatigue syndrome, and immune dysfunction syndrome. So this is basically just telling you that people who have these conditions, when they have abnormal postures, their symptoms are worse. And believe it or not, these symptoms are happening to all of us. If we have abnormal posture, this is putting a tremendous amount of stress on our muscles, joints, discs, and nerves, and this is causing us to actually work harder to be in this alignment. It's physically more difficult for you to be in an abnormal alignment. So we can definitely be more fatigued, more exhausted, more tired at the end of the day. And any type of stress, whether that's physical, emotional, or chemical, can put stress on the immune system as well and cause it not to work as well as it should. So yes, even an abnormal posture can affect the immune system from functioning as well as it should. Cervical kyphosis, which means a reverse curve in the neck. So remember, we want to see a nice healthy curve in the neck. So the green line is representing what that alignment should be. And then the red line in this picture is showing you what's going on. So we can see that the spine is actually in that reversed or kyphotic position. But cervical kyphosis, segmental or total, leads to total spinal misalignment. So this can create rounding of the shoulders. It can also create headaches because the nerves in your neck, some of them go up into the head. It can create neck pain, obviously, because of that abnormal stress and strain on those joints and on those discs. And it can also create scapular pain, which is pain in the mid-back, because the nerves in the neck also go to the mid-back area. A lot of patients who have chronic mid-back pain, it's actually coming from the neck. And this can also even cause lower back pain, believe it or not. Patients with relative kyphosis in the lumbar region, which means your lower back, has significantly more disability than patients with normal sagittal Cobb angle measurements. Sagittal Cobb angle is just a way of measuring that curve. So again, people who have kyphosis of the lower back have more disability than people who don't have that kyphosis. So here is a normal lower back curve. So this patient would be looking in this direction. So this is the front of them. This would be their stomach, and then this would be their back. So again, that black line representing what that curve should be. Here is an example of an abnormal lower back curve. So the black line representing the ideal alignment, and then the red line showing what's going on. So we can see that loss of curve in that lower back. We can also see some shifting of the individual vertebra too. And because of this, this creates more disability. And what is going on the inside? What's going on with that spinal cord, those nerves, and that disc? Well, this MRI shows you what's going on. This kind of white grayish matter that you see here, that's the spinal cord. This black stuff, that's the disc. And if we can see in this picture, the disc is literally putting pressure on the spinal cord. It's almost pinching it off. And can we see some pressure here as well? So again, that spinal cord is definitely being compromised. The nerve that's in that area is definitely being compromised. What if that nerve was going down into your leg? How do you think your leg would feel? What if this nerve was going into your digestive organs or your reproductive organs? How do you think those would feel? Probably not good, right? So this is an example of what is called a slip disc or a herniated disc. Oftentimes, when we lose that normal healthy alignment of the lower back curve, it puts so much stress on those discs that those discs can begin to degenerate or decay much faster than they should. And this could lead up to a disc herniation or a slip disc. Freeman was published in the Journal of the American Medical Association in 1957, and he stated aging in the spinal disc caused postural deviations, which led to intestinal diverticula, hemorrhoids, varicosities of the legs, osteoporosis, hip and foot deformities, overall poor quality of health and life, as well as shortened lifespan. So this is a doctor back in 1957 that's talking about how posture is more than just back pain, how it can actually cause dysfunction in all other aspects of our health. The abnormal trunk deformity groups tend to score lower than the normal groups with regard to subjective healthiness and life satisfaction measures. Now, this shouldn't be surprising. If you're in chronic pain, if you're chronically tired all the time, if you're not feeling well, you're probably not going to be very happy. So it's not surprising that people with these types of deformities score lower on their subjective healthiness and life satisfaction measures. And so this can include subjective health condition, everyday feeling, satisfaction with human relationships, satisfaction with economic condition, and satisfaction with present life. So yes, your posture also affects your overall mental health as well as your physical health. So when you lose the healthy alignment of your posture, it does affect your spine because your posture is essentially a window to your spine. Any deviation in your posture lets me know that there's damage, injury, or weakened areas of your spine. So if you have a shift in your posture, guess what? You're also going to have that shift in your spine. There is no way that your posture can shift from its natural healthy alignment without it affecting your spine, okay? These types of postures tend to be the worst on the spine as well because they put what's called a shearing force on the disc, and the disc is just not designed to handle this type of stress. So these types of postures will definitely wear those discs down much faster and actually can lead to having that disc herniation or disc bulge. So again, your posture is a window to your spine. Any deviation in your posture is going to represent a deviation in your spine. And your posture affects and moderates every physiological function from breathing to hormonal production. Spinal pain, headache, mood, blood pressure, pulse, and lung capacity are among the functions most easily influenced by posture. This was taken out of the American Journal of Pain Management in 1994. So again, we have known for a long time that your posture affects your overall health and wellness. There are three major causes of subluxation that can lead to overall postural weakness. They include emotional stress, chemical stress, and physical stress. So raise your hand if you're in a marriage or you have a personal relationship, if you're raising a family, if you have a job, if you have financial obligations, if you have to drive in traffic, or you have economic concerns. Raise your hand if you're outside and you're breathing in pollutants. If you're inside breathing in pollutants, you have to drink unfiltered water. If you're using alcohol or tobacco, you take prescription or over-the-counter drugs, or you make poor food choices. These are all great examples of chemical causes of weakness in the body. And some physical causes of weakness. Raise your hand if you were ever in a car crash, if you have athletic injuries, if you exercise in bad form, if you do any type of repetitive lifting or motions, if you have yard work, or if you sit unhealthy at a workstation for 8 or more hours a day. All of these are great examples of physical causes of weakness that can occur in the body. So what is the constant physical stress that we endure that we don't even think about? It is gravity. Gravity is a very strong force that can happen on the body. We don't even realize how strong gravity is until gravity starts winning. So again, it is vital that our spine is stronger than the forces of gravity to prevent our spine from decaying faster than it should. So again, in general, there is a correlation in body structure, health, and span of survival. So how we age is up to us. Any abnormal posture that goes undetected and uncorrected over time has the probability of getting worse. And this again is going to cause that early onset of spinal decay, joint decay, and disc decay. There are some many conditions of postural weakness that we can see in the body. So most of the time when we have a subluxation, it can often show up as a symptom. But one of the most common symptoms of postural weakness is fatigue. And again, that's because it takes a tremendous amount of energy to hold your body in an abnormal alignment over a period of time. So this can explain the constant fatigue, the constant tiredness, being exhausted at the end of the day. Yes, just having bad posture can make you feel exhausted and tired. What is the first and most common cause of subluxation leading to weakened posture and health? Believe it or not, it's the birth process. The birthing process isn't just traumatic on the moms, it also can be traumatic on the babies, especially if they're born with any form of assistance like vacuum extraction, cesarean section, or forceps. Sometimes the pressures that we put on the baby's necks as they're getting delivered can cause their spine to be subluxated from day one. Some common symptoms of babies that have subluxations are ear infections, colicky, sleeplessness, failure to thrive. Usually little kids, when they're subluxated, have a lot of symptoms that can be associated with that. And the way we adjust children is very different than the way we adjust adults. We usually use a very light, soft force. But kids respond very well to chiropractic, and we can see profound differences in their health and their wellness with chiropractic adjustments. Medical studies show that trauma to the upper cervical spine, which is your upper neck, during delivery causes two major problems. Those are lowers your immune resistance, and two, it can cause the spine to grow abnormally. This is why it's so important for kids to get checked, because we want to make sure that their spine is growing normally and that they're developing normally. Guthman, who was a German medical doctor, he studied 1,000 infants and discovered that trauma to the upper cervical spine caused many health problems beginning in childhood due to lower resistance to disease. By realigning the neck, they were able to eliminate these conditions of lowered resistance. So that's pretty awesome. Now here's a time simulation of the neck that shows that when you lose that normal curve to the neck, that is going to, again, put abnormal stresses and strain on the joints and on the discs. And this is what can lead to accelerated aging of those spinal joints and those spinal discs. So this is, in essence, arthritis. And again, the choices that we make, especially when it comes to our posture, can prevent this from happening in the first place. If we catch it early, we can prevent this from occurring. In some cases, if we don't catch it early enough, oftentimes it can be too late. So is it possible to regenerate your spine through our state-of-the-art systems that offer you life-changing results? Yes, it is. We have methods to correct your spine back to a normal, healthy alignment. So we can definitely change your spine and change your health. So here are some before and after x-rays of some patients. This was a 70-year-old man with neck pain and stiffness, and this is 10 weeks of care. We were able to reduce that forward head posture. He had 60 millimeters, which is quite a lot, down to 33. So we got 50% correction in just 10 weeks. Here is a 40-year-old female who had a reverse curve in her neck. So that curve was going in the opposite direction. She was also having a lot of symptoms. And here again, after a course of treatment, we were able to bring that neck curve back to normal. Here's a 17-year-old young lady with scoliosis. And here's the thing about scoliosis. It's a spinal deformity, so you'll never get 100% correction, but we can see improvements in both young adults and older adults, and even in children. We can definitely get some changes in those scoliosis postures. So this was 6 months of treatment. And so, yes, healing takes time. This isn't going to happen overnight. This is going to happen over time with good quality chiropractic care. There was another patient with a reverse curve in his lower back. He was actually told he needed surgery in order to correct this. But after a 9-month follow-up, we were able to see that we're able to restore that curve back to normal. This person was having a lot of pain. He couldn't stand for very long hours. He couldn't sit for very long hours. And so he was actually contemplating the surgery. But luckily, we were able to avoid that in his case. So here's an example of how we fix abnormal postures. We do what's called mirror image. So if your head is shifted to one side, guess what? We're going to mirror image and correct that to the opposite side. So we're going to do exercises that shift it to the opposite side. We're going to do adjustments that shift it to the opposite side. And then we can do a form of traction, which is like a prolonged stretch to that opposite side. If you have forward head posture, we're going to retract it back with an exercise. We're going to adjust it back. And then again, we can do a form of traction. So I understand that that traction unit looks a little bit scary, but believe it or not, most of my patients actually fall asleep in this traction. It's much more comfortable than it looks. And then one of the key aspects of our treatment plan is actually our home rehabilitation protocol. So all of our patients will have a specialized home rehab program for them. So it's different exercises and traction that you should do at home. Most of our patients qualify for what's called the Denerol unit. And these are orthotics that we can place under our neck, our mid-back, or our lower back to get those curves back to their normal healthy alignment. This is showing you an x-ray of someone laying on the Denerol unit. So this is what their neck looked like when they came in. We put a Denerol underneath their neck and took an x-ray. And so you can see while lying on the Denerol, it puts that neck more towards that healthy alignment. We do that over a period of time, and eventually the neck will stabilize in that alignment. So we have 3 phases of care in the office. We have the intensive phase, the corrective phase, and stabilization phase. So the intensive phase is where we're basically getting you out of crisis. Most of my patients come in because they're having some sort of pain, and we want to resolve that pain. We want to get you feeling better. So we're going to reconnect your brain to organs. We're going to reduce the inflammation and calm down the symptoms. And this can be every day for the first week to, a few times a week for the first couple of weeks. But once you're out of pain, then we move you into our corrective care phase. When you're coming into corrective care, you're coming in 3 times a week, and we do that for a period of 3 months. However, we do a re-exam every 30 days to monitor your progress. And then at 90 days, we take that x-ray again to see how well your spine is responding to the care. Research shows it takes a minimum of 90 to 180 days of rehab before you can see a change on an x-ray. So we definitely want to make sure that we're committing to the care. And then again, at that 90 days, we're taking that x-ray to see where you're at. And then, of course, that home rehab must be performed every day during the corrective care phase. Once your spine is corrected, then we move you to the stabilization care. This is where we monitor your posture to make sure that it maintains. Now, according to the research, yes, your posture will maintain once it's corrected. However, most of us don't live in a bubble, and we all have to deal with some sort of stress. And so it is important that we manage that stress, because over time, that stress can affect our posture. And if we're not managing it, then we can start to degenerate in our postures again. That, again, can lead to whole health issues. So we want to make sure that we're monitoring your posture, monitoring your spinal alignment to make sure that it's stable and strong. So we can do that anywhere between once a week to once a month. Most of my patients are coming in once a month, and I do have some patients coming once a week because they have some underlying health issues that they're dealing with. Oh, and then we also want to make sure that we're doing some form of home care at home. It's probably not every day, but we can reduce that down to, a couple of times a week. So what do you think the most important phase of care is? Do you think it's the intensive phase where we're getting you out of pain? Do you think it's the stabilization, or excuse me, the corrective phase where we're actually correcting your spine? Or is it that stabilization phase where we're making sure that your spine stays strong and healthy for a lifetime? Well, if you guess the stabilization phase, you're right. Because yes, of course, we want to make sure that your spine stays healthy for the rest of your life. So I want you to walk away asking yourself a couple of questions. First of all, where do you want your health to be in the next 20 to 50 years? I seriously want you to think about that and write it down. How do you want your life to feel like? I mean, do you be in pain for the rest of your life? I don't think so. I don't think any of us want to be in pain for the rest of our life. But seriously think about how you want to feel. And then what type of activity do you want to be able to do in the next 20 to 50 years? You want to continue doing all the things that you love doing today, whether that be hiking or backpacking or water skiing or snow skiing, whatever it is, playing with your children, playing with your grandchildren. What do you want your activity levels to be like? And then what is the most important aspect of your life? And then I want you to ask yourself, what steps are you taking to ensure that you're meeting these goals? Well, thank you for listening. I hope you learned something today, and I look forward to working with you in the future.